5 movements to ease knee osteoarthritis pain, the best exercise plan for stronger joints. Low-impact cardio, walking, swimming, and cycling are all great options for improving cardiovascular fitness and reducing inflammation in the knees. Strength training, exercises like leg presses, leg extensions, and calf raises can help build muscle strength and support the joints. Stretching can help improve flexibility and reduce stiffness in the knees. Good stretches to try include the quadriceps stretch, the hamstring stretch, and the calf stretch. Yoga and Pilates, these types of exercises can help improve balance, flexibility, and muscle strength, all of which can help reduce knee pain. Aquatic therapy, exercising in water can provide a low-impact, resistance-based workout that can help improve mobility and reduce pain in the knees. Remember to consult with a healthcare professional before starting any new exercise routine, and stop if you experience any pain.